Good evening, everyone. I'm Valerie Dennis, RN. I will be discussing the principles of scientific communication and the ethical implications in human research, particularly as they apply to allied healthcare professionals. I'll also delve into the ethical issues surrounding communication during research and share how we effectively and appropriately communicate with patients, families, and healthcare providers. Our first topic is principles of scientific communication. Effective scientific communication is essential for advancing knowledge and ensuring that research findings are understood and utilized appropriately. There are several key principles that guide this communication. Number one is clarity. Information must be presented in a way that is easily understood by the targeted audience. Two is accuracy. Data and results must be reported truthfully and without distortion. 3. Objectivity. Findings should be presented impartially and without biases. 4 is relevance. Information should be pertinent to the topic and audience. 5 is transparency. Researchers should openly disclose their methodologies, data sources, and any potential conflicts of interest. 6 is consistency. Information must be consistent across all forms of communication to avoid confusion. Our next topic is ethical implications in human research. Ethics are paramount in human research, especially in the allied healthcare field. Key ethical considerations include, number one, informed consent. Participants must be informed about the research's nature, risks, and benefits before actually consenting to participate in the research study. Number two is confidentiality. Protecting the patient's privacy, data, and personal information is crucial. Number three is non-maleficence. Researchers must prioritize participants' well-being to avoid causing harm. And 4, justice. Ensuring fair participant selection and equitable distribution of research benefits is essential. Our next topic is ethical issues and communication during research. Communication during research must be ethical, addressing several keys. Number one is honesty. Reporting findings truthfully without omitting any significant data or exaggerating results. Number two is accountability. Researchers must take responsibility for the accuracy and integrity of their communication. 3 is sensitivity. Communication should be mindful of participants' culture, social, and emotional backgrounds. And lastly, 4, avoiding misrepresentation. Ensuring that research communication does not mislead about the purpose, methods, or outcomes. This next topic is effective communication with patients, families, and healthcare providers. Effective communication within allied healthcare is crucial for successful patient outcomes and professional collaboration. This involves, number one, active listening. Understanding the concerns and perspectives of patients, families, and colleagues through active engagement. 2 is empathy. Building trust and rapport with patients and families by showing empathy. Number 3 would be clear and concise information. Providing information in a clear and concise manner to avoid any kind of misunderstandings. 4, cultural competence. Respecting cultural differences and tailoring communication accordingly to these. 5 is timely updates. Keeping all parties informed with timely updates and patient status and care plans. Our last topic is effective skills in writing formal correspondence. Formal correspondence in healthcare must be professional and effective. This includes a professional tone, using a respectful and professional tone appropriate for the audience. 2, structured format. Following a structured format with clear headings, paragraphs, and bullet points. 3, clear objectives, stating the purpose of the correspondence early and clearly. 4, evidence-based content, including evidence-based information to support these claims and recommendations. And number 5 is proofreading. Thoroughly check for grammatical and typographical errors. In summary, effective communication and adherence to ethical guidelines are crucial in allied healthcare research. By providing principles of clarity, accuracy, objectivity, relevance, transparency, and consistency, and by addressing ethical considerations such as informed consent, confidentiality, non-maleficence, and justice, we can conduct research responsibly. Furthermore, ethical communication, both verbal and written, enhances our ability to serve patients, families, and healthcare providers effectively. Thank you for your attention.